In this video, we're going to show you how to log in and start using Plano. The first screen you're going to see is a HIPAA compliant screen that's going to block the patient's name. To see the main screen, you would go to your dashboard. Your dashboard is going to lay out your patients when they're scheduled during the day, when they were seen, your sales, cash, and credit card revenue, and your schedule for the day. So you're going to be able to see the patients that are scheduled, why they're coming in, if they're using insurance or not, if their chart's been started. Now, the purpose of this video is to give a really high-level overview on how to use this application. The first thing that I would recommend doing is learning how to use the calendar. The calendar will allow you to book patients. So here we see that today is the 23rd, and if I want to book an appointment for, let's say, 10 a.m., I would simply click the 10 a.m. slot. So you can follow that back, and you can create an appointment. You would put the patient's information in, of course, their date of birth, the exam type, and the insurance. This information comes directly during setup. So if you haven't watched our video on how to set up your practice, please do. And then you can put all your insurance providers on here. It's very easy to set up an appointment. You would just say sample appointment, and you can put in an email address. You can put a telephone number in, date of birth, and then the exam type, the insurance, any member ID, and last four of the social. And when you hit save, it's going to show you the patient profile. Here you can put more information in. You can put in more details on insurance or medical insurance, primary members information, communication preferences you can turn off if you'd like to. You can add more of the authorization or confirmation information. If they've signed their HIPAA waivers, it can timestamp here for you. You'll also be able to see any previous visits that they've been seen with you. So charts would show up here, and any information that you need to add in terms of files, you can quickly add. So if you need to add like their intake form or anything like that, you can add it to the profile. When I go back to the calendar, you're going to see this 10 a.m. appointment. You can manipulate anything on here. If you forgot to send them a digital recall, you can just save that here as well. Now, if you need to look at more information on this patient, you can just simply search. So we're going to search sample, and it's going to pull up the sample patient that I just put in. Now, if I click manage, I can go back into that same screen. So that's another way you can get back to the patient. The next thing we're going to look at is how to start an encounter or a visit. One way of doing this is going to the dashboard, and when the patient shows up, you can click this start button here. That's going to start the appointment. And this appointment can be toggled on the left-hand side. You can look at review of systems, any autorefraction, interocular pressures, and then you get into the meat of the exam, your chief complaints, your habitual, your visual fields, all the tests that you do beforehand, subjective refraction, if they're doing a contact lens exam, you can add it here, your slit lamp findings, your fundus findings, as well as your assessment and plan. Here's where you would sign the chart. And then your staff may do this, or you may do it. You add your CPTs, and then you can actually add how much they paid for the exam. So this person's going to pay $1,000, and we're going to complete the visit. And what you're going to see next on the dashboard is that we made $1,000 in credit card revenue. And that all came from one patient here, so you can see that. Now, if the patient had a great experience and you paid the $49 for the Plus plan, you can actually send the patient a review so that they could review your practice, and you can get more five-star reviews on your Google web page or your Google results. So that was one way to start a visit type. I'm going to quickly show you the other way. So if you were to click on the patient, you'll get the profile. You can go to chart here and you can now see that we have an appointment. If you'd like to start the appointment from here, you could do that as well. You would just start a new appointment and you select why they're coming in.